Hi, good afternoon. Is this Dr. Arnold speaking?
Yes.
Hi, I'm Tan Yao Zhu calling from Nanyang Hospital. I would like to consult you about a patient. Her name is Madam Ng Yan Ying with the IC last four digit of 0238H. Okay. One the two medications of mixtard and insulatard will cause therapeutic depletion of the insulin. Hence, I would like to suggest removing the mixtard 30 vial 10 units twice a day. Okay, to confirm with you, I would like to remove the mixtard 30 vial 10 units twice a day because of therapeutic depletion. Okay, nothing more. Thank you very much. Hi, good afternoon. I'm Tan Yao Zhu and I'm a pharmacy technician for today. May I have your name and your IC?
Madam Ng Yan Ng. And my IC is S01002388H.
May I know if you're collecting this medication for yourself?
Yes.
Okay, may I know, do you have any drug allergy?
No.
Any medical history?
No.
And are you on any concurrent medications?
No.
Last but not least, are you using this medication for the first time?
No. Yes.
Okay. I will be dispensing you two medications. The first two is for your diabetes, and the last one is your metformin, which I'll cover it later. Okay, for your insulin, you have atropine and your insulatard. For your atropine, you should inject 10 units or 0.1 ml 3 times a day. And for your insulator, you should inject 20 units or 0.2 ml in the morning and 30 units, which is 0.3 ml at night. Okay. Some of the side effects in my experience is weakness, dizziness, hunger, sweating, trembling, blood vision, and fast heartbeat. This could be symptoms of hypoglycemia, which is caused by too much insulin being injected into your body. You can avoid this by eating sufficient meals on time and to exercise regularly. Another few side effects in my experience is swelling and mouth pain, and which is the redness and inflammation at the injector site. This will go away after a few days to a few weeks. To prevent this is to have a continuous rotation of the injected site to reduce the chance of developing such redness. Since insulin will cause weight gain, you are encouraged to exercise regularly to manage your weight. Now I shall show you how to actually use the insulin. Okay, so now I shall show you how to use your insulin. In the morning, if you are encouraged to use both your atropine and your insulatard together to reduce the needness to inject yourself multiple times. So as you can see, here's a needle. Remove the
The caps.
the cap first before you remove the syringe or
The needle.
First off, I would like you to take in around
20 units.
20 units of air and to inject it into your insulator. Next, you remove the syringe and inject 10 ml of air, 10 ml of air into your atropine. Now you do not remove the syringe. Instead, you actually
Flip it over.
you extract around 10 ml of your. Is it the lower needle or the upper needle?
The upper.
The upper needle. Okay.
Yeah. Okay.
You extract around 10 ml,
Okay.
10 units of your atropine and remove.
No. You turn around and remove.
Or you
Yeah,
turn
can.
before removing the needle, and you then also extract your 20 units of insulator. Hence, you have a total of 30 units. For demonstration purposes, let's imagine that this is your skin. You should pinch the injected area before you inject yourself. So do I actually
Yeah,
inject?
yeah, yeah.
After injecting yourself is to remove the syringe and the needle completely before you let go of your hand that is pinching your skin. To discard, instead of closing the cap off with your fingers, you should actually scoop it up on the table before discarding it into your trash bin. Some notes to take, some precautions or notes to take note of. If you miss a dose, you should inject the next dose at the usual time. Do not inject 2 doses to make up for the missed dose. If you forget to inject your insulin, your blood sugar may get too high, which is hyperglycemia. Hence, you should actually check your blood sugar level with a home blood sugar meter, which is your glucometer. For storage, you should store unopened insulin in a refrigerator between 2 to 8 degrees Celsius. Do not freeze it and do not keep insulin in a hot environment or expose it to the heat or sunlight. Clear insulin that's exposed to direct sunlight for too long can cause yellow brownish coloring. If that occurs, do not use the insulin. Once you open the insulin and it's in use, it no longer has to be refrigerated but instead should be discarded after 4 weeks. The instructions to discard your insulin is if you're using it at home, you may throw away the injection along with the used needles into a metal tin, glass jar or thick plastic container to prevent any needle stick injury. The precautions to take note of is if you have Novorapid, Hemolagot, Atropids will appear clear and colorless and your insulators will appear cloudy or milky. For when you're taking insulin, you should not have any alcohol consumption. Okay, last but not least is your metformin, which is also for treatment of diabetes. You should take 1 tablet twice a day. Take it at the same time every day. Some side effects you might experience is nausea and vomiting, diarrhea, stomach ache, loss of appetite, metallic taste in the mouth. You should also do not drink or operate heavy machinery as it can cause drowsiness as well.
That's it.
Okay, that's it. Do you have any questions?
No.
No. Okay, thank you very much.